In treating patients with OCD or OCD spectrum disorders, you have to keep in mind both the immediate and then the sort of long-term goals as well. So the immediate goals for patients with OCD is that you want to decrease the intensity, the frequency, the severity of the intrusive, disturbing, obsessive thoughts, and decrease the amount of time or the interference that the compulsive rituals cause. And we use things like exposure and response prevention, cognitive behavioral techniques to try to decrease the length of time that people are engaged in their rituals and the intense response that people have, for example, to the intrusive obsessive thoughts. We also use medications like the selective serotonin reuptake inhibitors to decrease the intensity and frequency of the thoughts, for example. Patients who respond to cognitive behavior therapy may not respond to the SSRI type medications, or patients who respond to medicines may not respond to cognitive behavior therapy. Some people may prefer one treatment or the other, and some people may need both types of treatments, so both medication treatments and then cognitive or behavioral treatments as well, in order to get a full response. But many patients don't respond to the initial treatments, and they may be resistant, and then they may need alternative treatments or more novel or experimental treatments. So we've studied a range of novel medications that work on different systems, like the glutamate system, for example, or that may work through different mechanisms, such as immune or inflammatory treatments, to treat patients who are resistant. And we've also utilized techniques like transcranial magnetic stimulation to address the underlying brain circuitry. And there are even surgical treatments like deep brain stimulation for tough to treat or refractory patients with obsessive compulsive disorder. However, the long-term goals are a little bit different. The long-term goals are really to enhance individuals' ability to engage in goal-directed or meaningful activities. So we want people to be fully engaged in family-related activities, work-related activities, hobbies that give them pleasure, for example, and not be overly focused on the things that trigger the obsessions or the compulsions. One of the big problems with people with OCD is they're consumed by these obsessive and compulsive concerns, and their life gets smaller and smaller and more restricted. And our goal over time in working with patients with OCD is to get them to be fully engaged in other meaningful activities, job-related activities, passions, or hobbies as well. And that will ultimately influence their quality of life. So it's not just decreasing the symptom severity, but getting them fully engaged in a range of meaningful activities.